Greeting, Professor Angela. My journal 3 is about addiction interview. Many tears are shed by those struggling with addiction, and tears are often accompanied by anger, frustration, fear, guilt, love, and loss. Also, most current research and treatment approaches point to multiple genetic and environmental factors in attempting to better understand all addictions and emphasis treating the whole person. Also, the DOC for the main drugs of abuse: alcohol, marijuana, cocaine, and opioids. And according to the article of attendance of at Narcotic Anonymous and Alcoholic Anonymous meetings, frequency of attendance and substance use outcomes after residential treatment for drug dependence, a 5-year follow-up study. This study investigates the relationship between frequency of attendance at Narcotics Anonymous and Alcoholics Anonymous and AAA meetings and substance use outcomes after residential treatment of drug dependence. The result: an AAA can support and supplement residential addiction treatment as an aftercare resource. In view of the poor alcohol use outcomes achieved by drug-dependent patients after treatment, the improved alcohol outcomes of NAAA attenders suggests that the effectiveness of existing treatment services may be improved by initiatives that leads to increased involvement and engagement with such groups. Actually, I don't have any friend or a family member who has substance abuse, so I decided to visit Virtue Recovery Alcohol and Drug Rehab Center, Houston, and I made an interview for one patient there. Their email there in the screen. Also, they are dealing with substance use disorders that can be difficult and can make one feel lonely and disconnected. That is why it is important that they provide clients with personalized, supportive, and effective substance abuse treatment. Substance abuse treatment programs that prioritize their success and well-being. They offer a luxury program that takes care of clients' overall well-being, include their mind, body, and spirit. They support in every step of the recovery journey and help navigate through any challenges. Also, their substance abuse treatment program include PTSD treatment, dual diagnosis rehab, alcohol addiction rehab, heroin addiction rehab, meth addiction rehab, benzo addiction rehab, cocaine addiction rehab, residential program, men's rehab program, women's rehab program, opioid and opiate addiction rehab, prescription drug rehab, alcohol detox, drug detox, medical detox, process addiction treatment, and finally, here are the questions and response that I got from the interview. First question: does this person have a drug of choice DOC? He said yes, he has the drug of choice is cocaine and alcohol. Number two, question number two: if so, what makes it the preferred drug? He chose this drug because he enjoyed the high that he got, also for coping with his stress. Number three, what interaction effects has this person noticed when taking both drugs at the same time? He said he became more nervous and aggressive with others. Question number four, does this person have spiritual beliefs that assist in their recovery? He said, yes, he does. Actually, he is Christian. Question number 5, what is positive about this drug for you and what is the other side? He said that there is not any positive effect, and to other side is the money, but that is not always great. Number 6, what are your worries about using drugs? He said his worry is death due to this drug. Question number 7, tell me what you have noticed about your drug use and how has it changed over time? He said this drug has taken everything from him, such as his living children and who he was before. Question number 8, what things have you noticed that concern you, that you think could be problems or might become problems? He said his concern is his way of living, meaning the fact that he was homeless. Question number 9, what have other people told you about your drug use? He said he has been told that he was better than drug. He need to start eating more and smoking less, so he should get help, and so on. Question number 10, what do you think others are worried about regarding your drug use? He said he did not know because the people who do not smoke say the same thing. Question number 11, what makes you think that you may need to make a change in your drug use? He said his appearance, self-worth, and he missed his 2 children. Question number 12, what might be the negative consequence for giving what might be the negative consequences of giving up drugs? He said he knew and believed that everything would become positive because he was already in negative place due to his DOC. According to overall the interview, my reflection with Addict X, he was aware from the beginning of his drug use of the side effects of this drug, from mood swings ranging from happiness to anger, and his neglect of his children. He was aware that this drug will destroy his body, that led him to death. But the problem lies in the bad friends who surrounded him, as he is submissive to their words. And about the drug, his feeling part of addiction always includes the feeling of desire, like he wants this drug, and that drug may improve his appetite for eating and reduce smoking. And as I understood from him, that he became a drug dealer that brings him material benefit. He needs to learn coping skill, in my opinion, like he wants to be happy and cope with his stress by meditation, sport, and change his negative thoughts. The strategies used by narcotics, alcoholics, cocaine announcements groups, according to the article, tweaking 12-step, the potential rule of 12-step self-help group involvement in methamphetamine recovery, that the more active engagement strategies appear necessary to increase the likelihood of a substance abuser becoming affiliated with and engage actively in 12-step self-help groups, treatment approaches or interventions that are meant to increase engagement appear to effective in doing so, and thus contribute to positive substance use outcomes through their impact on increasing 12-step activities and attendance. It has been recommended that community-based treatment programs, even those that label and represent themselves as 12-step oriented should evaluate whether their current program practices support active involvement in 12 steps self-help groups. Further, they also should examine the method employed by their counselor in this regard. Typically, when counselors do attempt to support a 12-step self-help group involvement in treatment as usual, they rarely use empirically supported methods. When clinicians use empirically validated techniques to support 12-step involvement, it is far more likely to occur. This has given rise to recommendations that some type of 12-step facilitation intervention be incorporated into treatment, with one exception. Studies that have evaluated 12-step facilitative intervention with stimulant abuser have found their outcome to be comparable to or better than other active therapies, such as cognitive behavioral therapy, CBT, or relapse prevention, RB. Compared a cognitive behavioral relapse prevention and 12-step oriented intervention delivered to cocaine abuser in a group format. The latter condition consists of recovery support group based on 12 steps of AA. It was designed to represent the 12-step philosophy often employed in treatment programs and focused upon the first 3 of the 12 steps, which is acceptance, higher power, and surrender. Both groups, which were guided manually, were scheduled by 2 hours group sessions over a 24 weeks period. Clients in both conditions evidence substantial reduction in substance use. However, no differences were found between conditions with respect to cocaine, marijuana, or alcohol use, either during the treatment period or at 6-month follow-up. Thank you for watching me, and I appreciate your helping us. Thank you, Dr. Angela.